Hey guys, so our vlog series is going to be about societal problems that have existed before the coronavirus crisis, and in particular how the crisis has highlighted and brought to the surface these problems.
I think it's safe to say that no society has dealt with the situation perfectly. It's probably impossible to deal with such a situation perfectly. All societies in these times are tested, and I think that's why it's important that we think about and talk about the societal problems that have led to inefficient or poor management of the situation, and I think dependent on the context, different societal problems have become obstacles, and so in this vlog we'll just discuss a few of those.
Yeah, so when reflecting about societal problems in times of corona, I guess the issue of healthcare just cannot be ignored. And for that reason, we got inspired to take a deeper look at how the coronavirus crisis is affecting healthcare systems in different countries and how these countries are dealing with it, but also how this pandemic might be exposing some of the flaws in healthcare infrastructure. And so I have spoken to two doctors. One of them is Raphael, and he's currently fighting in the front lines against the coronavirus pandemic. And so Raphael is a doctor he works in a hospital in Maryland near Washington, D.C. And he's an anesthetist, so he's directly dealing with coronavirus patients. And we're very happy to have been able to speak to someone who's in the United States. As many of you might know, the US is actually now amidst the countries who are hardest hit by the virus. The US death toll is now nearly 11,000, and it's got the most cases in the entire world. And many, or actually most states in the United States are now under some form of lockdown or isolation. So the reason that we chose to look particularly at the United States is that they're not exactly famous for having a very accessible healthcare system. And in fact, 44 million of Americans are not insured. And this is due to the fact that, first of all, it's not mandatory to be insured in the US, but a lot of people can simply also not afford it. And the reason they can't afford it is because healthcare is very, very expensive in the US. It's actually twice as expensive as it is in most other developed countries. And if you would see the US healthcare system as an economy, it would actually be the 5th largest economy in the whole world, which is quite striking. And then another factor is that they also have fewer ICU beds in relation to the population than other developed countries. And given these factors, there's a lot of skepticism in how the US is going to be managing this crisis. And so we wanted to know a bit more from Raphael, what he has to say about this. So far he's reported that there's only a few COVID patients in the hospital so far, but the surge is starting, and he says the worst is yet to come. What I found quite striking is that they're already running low on supplies. And so for that reason, we kind of start off talking straight away about how everything's being coordinated and managed and organized at the moment. And I'm going to tune you guys straight in. Enjoy listening.
No, it's very decentralized.
Oh, okay.
And, there's no federal organization.
Oh, okay.
The federal government is not taking any leadership on this. The states are doing whatever they can. The national government has taken no responsibility.
Oh, wow.
Has organized nothing at the national level. They've done like a little bit of policy. They helped just in New York City. I think they did two things. They supported the city mayor to get a ship.
Yeah, the comfort ship.
The city. Yeah, and that was just politics and show and stuff like that. That's a 1,000-bed hospital, 1,000-bed hospital ship. Okay.
But there's only 20 people in it, I read today. Like, it's more of it's more of a show.
It's just theater, okay?
Yeah.
It's just political stagecraft, okay, is what they're doing. And so it's just not it's not real. And then what the mayor himself, Cuomo, he he has consistently tried to defund and take money away from the public health system in New York City. So he is part of the problem, not the solution. Right now, he's pretending to be a hero.
Yeah.
But in fact, he has tried to defund the most needy hospitals and take away Medicare and have austerity economics for New York State. $6 billion less in Medicare funding for hospitals.
And this during this time?
Yeah.
What? So they're like redirecting funds from healthcare into other sectors, or how do I understand this?
He's just a very conservative, Republican. Like the mayor is like a very conservative, meaning that he doesn't like using federal money.
Yeah.
He's like basically anti-government.
Yeah.
Okay?
Yeah.
He works in government, but he's anti-government. He's anti-giving money to people for needs like social services and care. He's anti-social services.
Oh my God.
Medical.
That's exactly the people that are needed in government.
If you look at his record, it's terrible. He wants to defund Medicaid, so especially for poor hospitals. It's called Medicare Medicaid.
Mm-hmm.
It's a federal program that is administered by the states. So you get federal money, and then it's the money is spent by the states the way the states manage the money. Mm-hmm. But this is federal matching funds. So $6 billion for New York State. He defunded that, and the federal government would match the $6 billion. But he didn't do that. Mm-hmm. So his the healthcare system of New York State is very unprepared for a surge in health services. The United States will be a perfect example of where Mother Nature wins, and no amount of money and resources, if you don't have a well-organized national response and you don't take science seriously, and this White House, this president that we have now, has defunded the USA Pandemic Response Unit over the past 3 years. So it rendered them ineffective when we needed them. So the CDC, the Center for Disease Control, is not equipped to do pandemics. They do epidemics, they do endemics, and they do a lot of academic research, but they're not a pandemic response unit. They're completely not designed to do that. But the sad thing is that more people, I have a strong feeling that much more people are going to have morbidity and mortality over the next year from causes other than COVID.
Yeah.
Because their normal health care problems, especially Americans are the sickest Western civilized population of people.
Yeah.
The Americans are of Western civilized countries, they're the most overweight and sick.
Yeah.
And with the worst medical system, Western civilized. Now there's a couple of small Pacific islands where the body mass index is more. Some of these tribes, like Hawaiian tribes and so on, they're very, very overweight. But Americans of Western civilized countries, Americans are the most overweight and unhealthy population.
Yeah.
So they are at highest risks when you don't do preventive medicine, get their dialysis catheters, get their blood pressure and heart rate, do preventive medicine so they don't have the heart attacks and strokes and kidney failure. I think our health statistics will look much worse. So, the mortality in the U.S. is 2.8 million a year.
God.
It's about 55,000 a week, or almost 8,000 people die per day in the United States. Okay?
I mean, it all makes sense in a capitalized healthcare system. They don't profit if you're not sick, Like, why would they be bothered to make you healthy again? If, like, the pharmaceutical industry profits from sick people.
They want you to be, they consider you a consumer.
Exactly. You're a product. Yeah.
And they consider you a customer. So I'm a diabetes and hypertension customer, okay? Or I'm a stroke customer. And they want you to be as sick as possible to consume the most amount of medical resources, the maximum amount of medications, the maximum number of tests, so over-irradiated, over-medicated, over-treated, but not dead. But they want to maximize your consumption so they can profiteer off your consumption of healthcare resources and sell you the most amount of drugs and sell you the most amount of tests and x-rays. There's no economy. There's no thrift. There's no rational rationing of these where, you know, in a national health system say, hey, we have a fixed number of doctors and nurses and we can only do so many tests and so many procedures and you're going to wait in line. In this coming year, the projection, it's going to be a massive negative 18.4. So it's going to go down more than 20%. The biggest fall. This will be the biggest recession since the Great Depression of the 1930s.
Oh my God, since 1929. Wow.
Yes.
Yeah.
Not as bad as that. But we're on track to be exceed the largest recession besides that.
Yeah.
In the United States. So you know, for businesses to get back on track, they've released all their employees, they've shut down the business, they turned off the electricity and water and gas. For them to turn up and turn on and get back,
oh, absolutely,
their businesses is gonna be, you know, 6 months, a year. It's gonna be a long time, right? And so it's gonna be.
The thing is also, all these people who are filing for unemployment, like, it's going to take a while for your unemployment money to get in. It takes months for that to be processed. So these people are going to have to now apply for, like, credit or something. And even to apply for credit takes a long while, you know, like, all these people are going to default onto the other options such as credit. And it's going to take a while until that, like, yeah, like, people are running on no money at the moment. I'm just, like, this is going to get so bad.
Percentage of Americans have just no reserve.
Yeah, absolutely. They work 3 jobs to just feed their kids, you know.
So, yeah. So it's I can't imagine the economic hardship this has caused. This will expose the failures of the American way.
Yeah.
Of the way that you can think you can buy your way, to think that you can buy everything. Okay, that money will solve all problems. The strong marketplace and capitalism and privatized industries and profiteering off of, well, they're profiteering off misery. Okay, the healthcare industry here, the big pharma companies, profiteering off misery.
So overall, Raphael touches upon a lot of points, but I guess the main message that we can take from this is that a system that runs on independence and minimal provision of social welfare is actually not, it's going to actually cripple within a crisis like this. And as you said, the amount of federal funding for healthcare has been severely cut within the last 15 years, and the United States actually needs a way bigger national reserve in order to deal with a crisis like this. And another part of the interview that I haven't included, he actually mentions that because there is such inaction of the federal government, local states are actually at the moment competing for medical supplies. And what's happening right now is that there's a bidding war going on between these local states. And because of that, it creates this competitive market, which also drives up the prices. And I think that in a more fundamental way, this actually exposes the flaws of capitalism itself. Often capitalism is thought to be the most efficient way to organize an economy. But what capitalism is actually efficient for is making profit. However, the American example shows that such an overcapitalized healthcare system is not efficient in any way, but it's also just not efficient at all for dealing with a public healthcare crisis. And what makes this even worse is the inequalities that are existing in the United States. We've touched upon that in the interview, but the problem is that a lot of people will just not seek healthcare because they are afraid of the healthcare bills and they just simply can't afford them. And so the whole interview with Raphael really made me rethink the whole America First attitude that comes from the White House. I'm wondering how this narrative fits with the fact that 50% of federal spending is going on the military, while the healthcare sector has been gradually defunded. So I'm asking myself, are these expenditures within the military, for example, are they at the expense of health? So in essence, I think we should hope that soon the constituency will vote for leaders that are going to push for change and that are also going to push for the provision of medical care for all. Yeah, so our second interviewee is actually my dad. We interviewed him because currently he's in Spain as support staff in one of the biggest hospitals in Madrid. And usually he works in northern Germany. But given this emergency situation, he has decided to join a group of nurses and doctors from all over Germany who are all willing to help out in Spain, as the situation is so bad. And to give a bit of a background, I think many of you have been exposed to it in the news, but Spain is actually one of the worst hit countries in terms of corona. So Spain has had 140,510 cases and nearly 14,000 deaths as of today. And in terms of cases, it's the second worst hit country, and in case of deaths, it actually scores third. And so my first question, I just wanted to know from my dad how exactly this whole mission of going to Spain came along and what exactly made him go to Spain. And I'm just going to tune in and enjoy listening.
Ebbt die echt ab, ja?
2 Wochen eher hier sind sie. Ja,
Krass.
wir sind 2 Wochen zu spät. Ne?
Ah, okay.
Als ich den Brief an die Bundeskanzlerin geschrieben habe, da hätten wir fahren sollen.
Du hast einen Brief an die Bundeskanzlerin geschrieben?
Ja.
Echt?
Hab ich vor einem Monat habe ich den geschrieben.
Was hast du geschrieben?
Abgeschrieben, dass wir jetzt, wo unsere Krankenhäuser noch nicht auf Volllast sind, unbedingt europäische Solidarität üben müssen und italienische Patienten in unsere Krankenhäuser fliegen müssen. Und danach wird weiterhin Solidarität gefragt sein, wirtschaftlich das habe ich an die Bundeskanzlerin nicht geschrieben. Da hatte ich noch einen Leserbrief in die Cuxhavener Nachrichten geschrieben, aber den haben die gar nicht veröffentlicht. Ne? Also ich habe dazu aufgerufen, solidarisch zu sein mit unseren Nachbarländern. Ne? Und ich habe einen Brief an die Bundeskanzlerin geschrieben, habe ich auch noch nie gemacht. Und an den Abgeordneten Ferlemann.
Ja gut, da kommen sie ja noch eher ran. Also
ich habe aber keine Antwort gekriegt. Weder noch. Ne?
Ja, man fragt sich, ob die nie gelesen hat.
In dieser Krise haben alle nur an sich selbst gedacht. Ne? Und dann erst beim zweiten Denken haben sie dann gedacht, oh, Moment mal, da war doch was. Ne? Und dann kam das ja. Aber 2 Wochen zu spät kam diese Solidarität auf. Das ist dann langsam gekommen. Aber es hätte viel eher kommen müssen. Weil unsere Kliniken waren ja alle leer, weil wir nichts mehr geplant gemacht haben. Wir saßen praktisch da und haben auf Patienten gewartet. Es kamen aber auch keine Notfälle mehr. Die Patienten kamen auch mit ihren Kleinigkeiten nicht mehr. Ne? Und wir haben den ganzen Tag Däumchen gedreht. Ne?
Krass,
und ich habe Papers gelesen. Ne? Und habe Newsletter gemacht über Corona. Ne? Da habe ich halt gesagt, Leute, lasst uns unsere Energie doch nutzen für andere. Ne? Und dann habe ich vor 10 Tagen habe ich eine Mail geschrieben an unseren Geschäftsführer, wo ich genau das gefragt habe, können wir nicht als Helios jetzt mal helfen. Und dann hat er mich am nächsten Tag angerufen, ich habe jetzt Ihre Antwort. Da hatte nämlich die Zentrale eine Mail rumgeschickt an die Geschäftsführer und die Chefärzte. Die suchen Leute, die bereit sind zu helfen. Und da hat er mir sofort gesagt, wenn Sie gehen wollen, haben Sie meinen Segen. Und dann habe ich sofort da mich gemeldet in der Zentrale, in der Helios-Zentrale. Und die haben das dann innerhalb von einem Tag haben die Sache dann eingestielt.
Krass.
Dass wir sind nicht für Krisen ausgerüstet. Ne? Wir
Nee.
sind auf Kante gestrickt
Ja,
und das geht so gerade, aber wenn einer krank wird oder wenn einer ausfällt oder wenn es eine Krise gibt, dann bricht
ja,
es zusammen.
ja,
Man muss wirklich den Spaniern Respekt zollen, wie die hier alles umgebaut haben in so kurzer Zeit.
ja.
Die haben die Krankenhäuser komplett umgekrempelt. Die haben eine logistische Meisterleistung hier hingelegt. Die haben ganze Stationen neu eingerichtet als Intensivstationen.
Krass, ja.
In unserem Krankenhaus gab es eine Turnhalle von der Reha-Abteilung. Da liegen jetzt, ich glaube, 30 Covid-Patienten drin.
Ach, krass.
Mit diesen Masken. Ne? Und so haben die aus mehreren Einheiten in diesem Krankenhaus, wo normalerweise ambulant Patienten behandelt werden, haben die Intensivstationen gemacht.
Krass,
Und eine
ja.
Intensivstation machen ist ja nicht so einfach. Ne?
Nee, absolut. Ich meine, das überhaupt nicht.
Sauerstoff dahinlegen,
Du brauchst ja
Sauerstoff
Sauerstoffleitungen,
hinlegen,
wo du dann da überall
Genau.
den Sauerstoff
Das
durchkriegen
haben
kannst.
sie alles reingelegt. Ne? Sauerstoffleitungen, Druckluftleitungen, Stromleitungen,
Krass, ja.
alles gelegt. Ne?
Das haben sie alles. Und wann haben sie damit angefangen?
An einem Wochenende haben die
Einem
eine
Wochenende.
Intensivstation gebaut. Ne?
Krass.
Und das haben sie auch alles gebraucht.
Wow. Und die Ressourcen, wie haben die denn so schnell alle Ressourcen zusammengekriegt, dass sie das mal eben machen konnten?
Also in dieser Kette haben sie das gut geschafft. Das ist eine private Kette. Ne?
Ja.
Haben öffentliche Krankenhäuser, aber gehören einer privaten Firma. Ne?
Ja.
Die staatlichen Krankenhäuser haben es wohl nicht so gut geschafft. Ne? Die sind nicht so gut organisiert. Ne? Also unser Haus ist sehr gut organisiert, muss man sagen. Insgesamt die ganze Belegschaft ist jung, viele junge Ärzte. Ne? Die Stimmung ist super. Ne? Die arbeiten zusammen, die freuen sich, wenn sie sich treffen. Ne? Eine Solidarität, eine Hilfsbereitschaft, eine Freundlichkeit. Ne?
Ja. Wäre schön, wenn die Leute, die jetzt da in Spanien sind, das mitnehmen würden irgendwie. Also wenn dieser Geist irgendwie übertragen werden kann nach Deutschland. Vor allem, weil Deutschland noch nicht so weit ist in der Krise, weißt du?
Ja, ich denke, wir nehmen mehr mit, als wir hier hingebracht haben.
Ja.
So viel konnten wir hier nicht anfassen, ne? Weil die Welle ebbt jetzt ab. Ne? Wir haben doch deutlich weniger Patienten.
Immerhin.
Aber wir selber haben so viel gesehen und gelernt. Wir haben auch ganz viel jeden Abend zur Zentrale gegeben, ne, in unserer abendlichen Konferenz. Wir haben Behandlungsalgorithmen, haben wir jetzt uns geholt und alles, das bringen wir alles mit. Ne?
Ja.
So haben wir dann schon einen gewissen Vorsprung. Ne? Also es macht durchaus Sinn, solche Krisen international zu meistern.
Ja, aber denkst
Nicht
du...
zu sagen, das ist jetzt dein Problem und ich
Nee,
hoffe, dass es
absolut
meins
nicht.
wird, ne?
Ja.
Also sagen wir so, die EU hatte keine Mechanismen, um damit umzugehen.
Ja.
Ne?
Ja.
Gesundheitspolitik stand nie auf der Agenda
Ja, das
der
stimmt.
EU und es gab keinen Gesundheitskommissar oder sowas, ne?
Ja.
Der irgendwelche Macht hatte. Ne? Und die Macht über die Grenzen haben die einzelnen Länder. Die EU konnte nur hilflos zusehen, wie die Grenzen zugemacht haben.
Ja.
Die EU kann aber jetzt viel machen durch Umverteilung von Wohlstand.
Ja.
Weil die Deutschen können es besser aushalten, wenn 4 Wochen die Industrie stillsteht, als die Italiener.
Klar, und du hast eine Zentralbank, so der Euro ist sowieso in all den Ländern.
Und deswegen denke ich, dass die bei der Krise weniger verloren haben, müssen jetzt abgeben.
Ja,
Ich
definitiv.
wäre ja auch bereit, von meinem Gehalt was abzugeben. Werde ich ja sowieso müssen, weil mein Geld wird weniger wert werden. Ich werde
Inflation,
ja auch welche Steuern bezahlen
absolut.
müssen.
Ja.
Irgendwie wird man auch die zur Kasse bitten müssen, die ihr Gehalt durchgehend bekommen haben, so wie ich. Ne? Und die müssen einfach mitbezahlen.
So the underlying issue which Dr. Bernward / my dad has addressed in the interview is the absence of mechanism and for international cooperation during a health emergency like this. Just as much as it has been a problem with local governments in the United States, it's also been a problem with states within the European Union. And of course, every country has been struggling to deal with this crisis itself. They had their own domestic issues. However, the initiative to show solidarity came from individuals like my dad, and then, of course, also from leadership of hospital chains. But as the example of my dad showed, actually less from sides of the government. And even though cooperation is actually a win-win situation, for example, as my dad showed, doctors who go to other countries and nurses who help can take back knowledge and experience to their own country. And my dad also addresses redistribution after the crisis. And indeed, there has been a debate within the European Union about how to deal with the economic impact of this crisis. And so just recently, southern European countries such as Italy and Spain have pleaded for there to be a joint economic debt within the European Union in order to help weaker economies deal with the impact of the crisis. However, this has been rejected from richer countries such as Germany. And what's actually unfair is that then both Italy and Spain, who have been hit disproportionately hard by the crisis, but have also weaker economies in relation to more northern European countries. And so I kind of drew a comparison here to the migrant crisis, where, of course, Germany was very present in the migrant crisis and helping in the migrant crisis, but still, Italy was, for example, left with an unproportionate burden of dealing with that crisis. And I think that overall this crisis is just another reminder for us to think about what the European Union actually means and how we define European solidarity. We need to ask ourselves to what extent we're obligated to help in a situation like this, because we are all a union. To conclude both the interviews, that I think it has become very apparent what both my dad and Raphael said is that in this crisis, this kind of crisis has highlighted that there has been an absence of response mechanisms and coordination mechanisms in order to deal with it. And also, this is not the last contagious virus that we will experience. Within a globalized world, viruses will always spread more quick, and the effects will be worse. And new viruses have been emerging in less than every 10 years in the past. And so I think that this crisis should show us that while globalization is a very material process in a way, it should perhaps be more about cooperation and less about competition. So that's just my final conclusion for this whole video. I hope you enjoyed listening to it. I hope it maybe stimulated your thoughts. And for now, I hope everyone stays safe, and don't forget to stay at home. And bye bye everyone.